We hear it in almost every consultation. I can't use that. I have sensitive skin. My skin reacts to everything. I have to be really careful because my skin is so sensitive. It has become the default self-diagnosis for any client who experiences redness, stinging, tightness, or reactivity. But as skin professionals, if we accept the label without questioning it, we easily build the wrong treatment plan for our clients. Because here's the distinction. Many of the clients who are sitting in your chair do not have truly sensitive skin. They have sensitized skin, and treating those two conditions as though they are the same is often exactly why client skin is not improving. Today, we are breaking down the difference between sensitive skin and why getting that distinction right changes everything about how you assess, treat, and support the skin. Let's start with the true sensitive skin. True sensitive skin is an inherent genetically influenced condition. The skin may have structural differences in barrier function, neurosensory activity, or both. We often see this in clients with a predisposition to conditions such as atopic dermatitis or rosacea. These clients may have difficulty retaining moisture effectively, a lower threshold for irritation, and a nervous system that responds more quickly to heat, touch, products, or even environmental changes. In professional skin analysis, this may present as a diffused redness skin type. Because this tendency is inherent, our goal is not to cure the skin type. Our goal is actually to prevent further barrier disruption, reduce unnecessary triggers, and to keep the skin as calm, resilient, and well-supported as possible. Sensitized skin is very different. Sensitized skin is acquired. It is a temporary or ongoing state of hyperreactivity caused by barrier dysfunction, often at the hands of our clients themselves. Environmental exposure can also be a trigger, and inappropriate product use, overtreatment, or combination of all of these factors. So how does the skin become sensitized? In most cases, it goes back to barrier disruption. Perhaps the client is using a foaming cleanser that repeatedly removes too many of the skin's surface lipids. Maybe they're layering exfoliating acids, retinoid scrubs, and active serums without giving the skin time to recover, and they may also have accumulated UV exposure, environmental stress, friction, or repeated professional treatments that have gradually weakened the stratum corneum of the skin. Once the lipid barrier is compromised, two things begin to happen. First, transepidermal water loss increases, contributing to dehydration, and it also interferes with normal enzymatic activity within the stratum corneum. And secondly, the barrier becomes more permeable, allowing ingredients and environmental irritants to penetrate more easily and trigger an inflammatory response. The skin is not necessarily sensitive by nature. It has become reactive because its protective system is no longer functioning properly, often because the skin has been treated too aggressively. I often describe this as an alarm system that is stuck in the on position because the front door has been left wide open. This distinction should guide your entire treatment strategy. With true sensitive skin, like diffuse redness, the goal is long-term management. You are supporting the skin type that may always have a lower tolerance threshold, so consistency, prevention, and barrier protection is absolutely essential. With sensitized skin, the goal is to identify that caused the decline and help to reverse it. This is where you have to become a skin detective. What is stripping the barrier? What is increasing inflammation? What changed before the reactivity began? Is it the cleanser, the exfoliation routine, the treatment frequency, the environment, or a combination of all those factors? Once you identify and remove the antagonists, you can begin replenishing the physiological lipids in the barrier that it needs, and particularly the ceramides, cholesterol, and free fatty acids, and the support the rebuilding of the stratum corneum. As the barrier recovers, the skin often becomes less reactive, stinging decreases, tightness improves, and product tolerance may gradually return. That is why accurate assessment matters. If you misclassify sensitized skin as permanently sensitive, you may spend years managing the condition that could have been substantially improved through barrier correction alone. And if you treat a truly sensitive skin as though it simply needs to be toughened up, you may create even more inflammation and instability. If you want to go deeper into this kind of clinical reasoning and connect with other skin professionals who are strengthening their assessment skills, that is exactly what we do inside the Skin Strategy Collective. It is where we move beyond labels and surface-level protocols and start understanding the mechanisms driving what we see in the skin. The key takeaway is simple. Sensitive skin is inherent, and sensitized skin is acquired. One requires ongoing management while the other requires investigation, trigger removal, and barrier repair. When you understand which one you are looking at, your treatment plan becomes clearer, safer, and far more effective. I'd love to know what you're seeing in your treatment room. Are most of your sensitive skin clients truly sensitive, or have they become sensitized? Let me know in the comments below. And if this video helped clarify the difference, give it a like, subscribe to the channel, and share it with another skin professional who may find it useful. And I will see you next week.